So click on where it says translate into English, and a box will open at the top of your screen where you can choose what language you would like the captioning translated into. We also do have someone, Nadia, who just spoke on the line, and she can help translate questions for Spanish speakers. So Nadia, over to you again.
Si tienen preguntas, pueden escribirlas en la parte derecha de su pantalla. Presiona el cajoncito en la parte de abajo, donde está la hora, o mándelas también al dspdinfo@utah.gov. Para esta presentación, usted puede prender los subtítulos en español. Para hacerlo, presione el cajoncito que tiene las dos Cs abajo de su pantalla. Presione English y saldrá un menú en el medio de la pantalla. Presione Translate Captions en la parte derecha para que el cajoncito se ponga azul y tenga una aspa. Presione la flechita en Translate to y seleccione Spanish. Presione la X en la parte de arriba. Esta reunión está siendo grabada, así que le pedimos que presione el botón rojo en la parte de abajo del micrófono para así no grabar ruidos fuera de la presentación. Si tiene preguntas y está usando su computadora, puede presionar el botón con la mano y presione el micrófono para poder escucharla. Le estaré ayudando a traducir preguntas que tenga durante o al final de la presentación. Gracias. Back to you, Bob.
Thank you. Okay, before we get started today, we wanted to remind you that this meeting is being recorded and it will be available Friday on the DSPD website under the Individuals and Families tab, and then the Be Informed and Be Involved heading. Please remember to mute yourselves and type any questions into the chat box or email them to dspdinfo@utah.gov, and then we will try to address all the questions towards the end.
That part is already done. You can continue.
Okay. All right. Thanks, Nadia. Okay. So let's, whoops. Okay. Take a look at our agenda. Okay. So we're going to start out with a few announcements. We also have an update on a project that Ombudsman's project. This one will be a little bit out of order. One of the people that we're going to speak about this has also got a conflict for the first 30 minutes, I think. But when they get here, we'll just sort of fit that in wherever we can. So the first thing we're going to start with is legislative updates. We've got updates on the waiting list, staffing, caregiver compensation, and limited supports waiver. We are then going to spend a little bit of time talking about employment, both the employment preparation service and the employment pathway tool, which we are now using. Got a brief COVID-19 update, and then we're going to have a guest speaker to talk about community resources for us from the DD Council. Okay. So, in concerning announcements, these kind of two things go hand in hand with each other. The one is just a little bit of a reminder that if you have an RFS request or request for services, please work with your support coordinator directly on that request. Always remember that your caseworker or your support coordinator is your advocate, and they'll work with you on those requests. We do ask that you do not directly contact any of the RFS committee because it tends to slow down the process and it makes it harder for folks to remain objective. And then kind of related to this, well, it's maybe an RFS request, but just a reminder, I believe we have sent emails out to everybody, but Leonard Consulting will only be serving DSPD through the end of June. And so if you are using Leonard as your fiscal agent, please work with your support coordinator to make the transition to another fiscal agent as soon as possible. The three remaining fiscal FMS or fiscal intermediary agencies are all still available and they're accepting new participants. And then just kind of a FYI, you're welcome to make the transition anytime before July 1st of 2022. However, even if you don't want to transition until July 1st, which is fine, we really strongly encourage you to start working on the paperwork with your support coordinator to make sure that everything is together and in place so that things will go smoothly on that when you make that transition over. Okay, I'm going to touch on a couple of our legislative updates, and then I'm going to get some help on some other of the legislative updates. The first update we want to talk about is for our waiting list. So for fiscal year 23, our legislature has funded $6 million to bring people into DSPD services. We've started transitioning monthly groups of clients into services from the wait list, and services will begin July 1st for this group of people. We're really excited for this opportunity to support families. One thing to just sort of be aware of is this will be, because it's quite a bit of funding to bring quite a few people into services. We are doing it month at a time, and so it will be spread out rather than trying to do it all up front, because we just simply wouldn't be able to do that. Concerning this money, also this funding, about 90% of this will be used to bring people with the most critical needs off of the waiting list. And what that means is that people will be brought into services based on their placement on the wait list. And then the other 10% will be used for the limited supports waiver. We're going to touch on the limited supports waiver a little bit in a future slide, but we'll get to that if you're unaware of what that is. For the limited supports waiver, we identify individuals that are based on that have really lower needs assessment scores. And so once we do that, it's really then based on how long a person has been on the wait list in terms of the order of enrollment. Additionally, for the period between April through June, we're providing one-time supports to nearly 200 people who are on the waiting list using our carry forward or money that we did not utilize. And so we also anticipate being able to distribute additional one-time funds for people on the waiting list beginning July 1st. So those are all pretty good news for us. As just sort of a reminder about the waiting list and being on the waiting list, if you're interested in wanting to know where you are, what position you are on the wait list, please contact your caseworker. Additionally, just as another reminder, if things change in your situation and you're on the wait list, please contact your waitlist worker or your caseworker. Update that information in our system, and it may impact where you are on the wait list. Please know about those things. And also, if you do not know who your waitlist worker is, feel free to shoot an email over to dspdinfo@utah.gov, and we can find that information and get it back to you if you need to talk to your caseworker. Okay. Also from our legislature, we've got some other things, and we've heard from so many people about the challenges faced by a lack of provider capacity and staffing challenges. So we're really happy to announce that as of April 1st, the legislature has given us its 19.54% to provider rates to help with these problems. Per the legislative intent, providers must use this rate increase for the sole purpose of increasing the salary and benefits of all staff positions that spend 60% or more of their time providing direct care to people. No portion of the increase can be allocated to administrative functions, provider profits, or retained earnings. We do continue to search for more solutions for the staffing challenges that are faced by our provider system. However, anecdotally, we're hearing that from providers that this wage increase has really allowed them to better attract and retain qualified staff. So we hope that that is trickling down to other people out there, and they're recognizing and seeing that these changes are happening really due to the funding that our legislature has provided for us. Okay, we've got a few other legislative updates, and I'm going to turn it over to Kristen to go through these on caregiver compensation.
Hi, Bob. Let me pull up that really quick. So we are putting together some frequently asked questions that we keep hearing about caregiver compensation from support coordinators. And some of them we wanted, that we think are applicable to the family too. So we wanted to go over those with you really quick. I'm sorry, I can't find where we put them. So let me just go through the six. Okay. So the first one was, will caregiver compensation be made ongoing? And so the program is currently funded until June 30th, 2023. The Utah legislature gave us some money to extend that program for another year. And any decisions about if it's going to continue after that year will need to be made by the legislature. And we will, as soon as we hear any information about if that will go forward, then we will let you know that information. So how many paid hours can a caregiver provide? So a caregiver can provide a maximum of 40 hours per week. This is based on the needs of the individual and is approved by the RFS committee if more hours are needed than is currently in a person's budget. There, you can make budget neutral changes if you have like SL1 or other services to move them over to SL3. But if you need more additional hours, then the RFS committee will review that request. And they're looking at the whole spectrum of services that an individual needs and taking into account other things like respite or schooling or other services that an individual needs. So it often is less than 40 hours a week that is approved, but 40 hours a week is the maximum that can be approved. So the next question, if you have more than one child receiving DSPD services, can both parents be compensated? And that answer is yes. If there's two children who are in services and both parents are providing services, then it is possible to have more than 40 hours that can be approved for one household. Each individual in services can only receive 40 hours and each caregiver can only receive 40 hours. So that you have to look at that combination, but it is possible. And again, that goes back to the documented and assessed needs of the children and the family. And it can often vary for individuals based on their individual circumstances. So is a family's financial situation taken into consideration when determining the amount of caregiver compensation that is awarded? And again, the focus is really on whether the service is in the best interest of the person, whether it meets their needs, whether it's something that the whole team and especially the individual wants. The focus is not on the financial situation, but on the individual and what their what is in their best interest. And last one, are step parents eligible to receive caregiver compensation? And yes, a step parent can provide caregiver compensation support. I think that's all the questions we had right now. If you do have more questions, if there's things that you would like us to address, we're going to be putting all of these into a document and making sure that those are available for everyone. So if you have other questions, please let us know. We'll get them answered and get them on the sheet so that you can have the answers you need. And that's all.
Thanks, Kristen.
Thanks.
Okay, I think, is Emily, are you with us?
I don't think Emily was planning on presenting this, Bob, if you don't mind going over it.
Oh, I don't mind a bit. I don't have a heck of a lot to say other than what's on the slide. Sorry, folks. But our limited what's that?
I can go over the stories and the talking points if you want.
Oh, I will let you do that then, Katie, if you're ready. That'd be great. Thanks.
Yeah, we just wanted, many of you already know that the limited supports waiver became effective at the beginning of this year. So this is kind of a new waiver for us that provides limited supports with spending caps. And the waiver hasn't been in service for very long, but we're already hearing positive stories from people who have been able to use this service. So we just wanted to quickly share a couple of those stories. So the first individual, his family had never considered that he'd ever move out on his own. But this waiver helped open up a whole new world for him. He hated cooking, but now with the help of supports, he looks up recipes, makes a shopping list, he goes shopping and makes dinner. He also was able to get a pill dispenser so that he can care for all of his medications on his own. He was very shy out of school and was spending most of his days on video games and things inside the house. But now he is able to do something at least once every week that's physical and outside, something like hiking or going somewhere to jump on a trampoline or go to the park on walks. And he really loves doing those things. He just really needed the support in the community to make it happen. And he's also started researching what it would cost to live out on his own and make decisions of what is important to him in finding his own place. And then the second individual who's really benefited from this limited supports waiver, his mother had just passed away, and his father previously had worked while his mom took care of all of this individual's appointments and activities and therapies for him. And his dad just really didn't know where to start. So we've been able to help with finding resources such as, changing guardianship and vocational rehabilitation application and things like that. So we've really been able to help with kind of understanding that day-to-day stuff. So this has helped his father to support his son in the services that he really needs. This person had a lot of behaviors in the past and is now getting support for that. He gets overwhelmed very easily and wouldn't always answer people when they spoke to him. But he's recently made some of his own goals in his person-centered support plan meeting. And when he got frustrated at that meeting and feeling overwhelmed with questions, he asked to be excused, took a break, and then he came back and all on his own, learning these coping mechanisms. So these are just a couple of success stories for ways that we've seen this limited supports waiver be really beneficial for people. And with that, I will hand it off to Bryn and Tamara to talk about employment preparation services.
Thanks, Katie, and good morning, everyone. I had to check the time to make sure it was still morning. The first of the updates, like we said, we wanted to update on the employment preparation service. Sometimes you might hear that referred to as EPR. The employment preparation service began on March 17th, 2022. Maybe just as the update for this group, providers and support coordinators have been working to transition each person to the employment preparation service as needed over the last few months. We wanted to let you know that the Employment and Community Inclusion team, which I am a part of, are also available to answer questions and provide any assistance. Information about employment preparation services can be found on the DSPD website at dspd.utah.gov/providers/EPR. And I think we're going to put some of that in the chat. On that link, you'll see some information specifically for individuals and families under an orange tab. Then click the heading, "Do you need preparation for a job?" And the information will be there. An Employment and Community Inclusion team email is being created as well to submit questions and comments to us. We'll send a link to that email in the future. If you have any questions prior to us starting that email, please send your questions to dspdinfo@utah.gov. Okay. Next, we wanted to introduce, and we're excited to introduce a person-centered planning tool we've been using for a little while and that we developed. It's called the DSPD Employment Pathway Tool. This tool walks anyone through a guided conversation on employment. The tool starts with a general discussion about any of your or your family members' interests, preferences, skills, community activities, or community participation. Then as you continue the conversation, you'll focus more on employment and community-based interests and how best to support you or your family member to have positive experiences in the community. We have a link to the tool, which we'll be sharing in the chat as we talk about each of these parts of the tool. We'll go to the next slide. We want to explain quickly why we created the Employment Pathway tool. This tool can be used to walk a person, anyone, through a guided conversation about their employment interests and desires. The reason we created the tool was to help each person reach informed choice about employment. Informed choices are simply educated choices. To make that educated choice about employment, we need to be provided accurate and current information, explore all options that are available, and have some hands-on experiences to decide what we want to do. All of us use this approach for any big decisions, right? Maybe it's moving to a different city, maybe it's a medical decision, maybe it's a decision about starting or continuing in school, and I'm sure there's others that I could add to that list. The tool provides informed choice for jobs that are competitive and integrated. When you hear people say competitive and integrated employment, or CIE, they mean jobs that are open to everyone in the community. That's one. Jobs that are paying above minimum wage, and a wage that is the same or close to a coworker without disabilities who's doing that same job. And also a job where you're working alongside people of all abilities. Each person, really, I think it's important to, as we start talking about this tool, each person will be in a different place on their path or journey to employment. The Pathway tool is flexible. It offers some suggestions for conversation or next steps, but you are absolutely encouraged to answer or ask your own questions, personalize the conversation, and are free to come up with plans that are not included in the suggestions. Go to the next slide. Okay, so the tool starts by asking this basic question, which is which pathway is right for me? The Pathway tool has 4 pathways. You choose one of the pathways based on where you are right now with employment. We'll just go through those options now. So the first option is Pathway A. The person is unemployed right now, but interested in one of those competitive and integrated community jobs in the future. The next option is Pathway B. The person is unemployed right now, and at least currently is not interested in a competitive and integrated job in the future. So that's one option you can choose. The third option, the person is working in those community jobs, but want some kind of change, right? Maybe they want more shifts, maybe they want different responsibilities, maybe they want to look for a second job. And the fourth option, the person is happy with their situation and simply wants to maintain that job and continue to find ways to grow in their career. So you're going to choose one of those. Go to the next slide. Each pathway has different questions based on your current situation and desire to work. We ask the questions to help you as the job seeker to fully understand your decision and what work could look like for you. Each pathway has some suggested questions based on your situation and a box at the bottom of the page to record thoughts and answers. So the questions you ask and the answers you give should help everyone to understand more about you. I think that's really important. And then also what you would like to do for work. You might be asked, what are you good at? That's one of the questions maybe. What are some skills and abilities that you have? Or maybe what you would like to learn more about. Again, these questions are just suggestions. If the person leading the conversation knows you well, maybe that's a support coordinator who's leading that conversation, and they want to ask different questions, they can absolutely do that. Or maybe you have something that you want to share that doesn't fit under one of those questions. You should absolutely feel free to adjust the tool and let everyone who's participating with you in this conversation know your thoughts. Go to the next slide. Okay, as the discussion continues, you can expect to talk about all the options that are available to you. Your support team might work together to understand all the current information out there for work. And if you're interested in working, or excuse me, if you're not interested in working after this conversation, what other community activities would you like to do instead? From the conversation, then we move to the next step, which is to develop a plan. And we'll talk about that on the next slide as well. After you move through the questions about what work could look like for you, the last section simply answers this question on the slide also. What happens next? The tool provides some suggestions you can use as examples in the areas of person-centered planning and vocational rehabilitation. All you're doing in this section is writing down and discussing what you and your team are going to do next, right? If you're not interested in a job, that usually means some hands-on experiences to expose you to a few different job opportunities so you can make that choice. If you are interested in working, what happens next would be your plans for how you, your family, friends, staff, a support coordinator, school teachers, and other supports like vocational rehabilitation will help you to reach your employment goals. Next slide. So continuing answering that question, after you've decided on some of those employment goals, you might go a little step further, which is thinking about how you will connect with or use the resources that are available to you. You can also use this tool to keep track in this section of any changes that happen in your life or updates to the plan you might have. Then I think the last statement there is just to continue to be open to new interests and explore new or expand on existing areas of interest as those new experiences come up. And so that's kind of the introduction to the tool. It's fairly simple. We've got a link in the chat there. And if you have more questions, feel free to reach out with the email we submitted. Thank you.
Thanks, Bryn. Okay, just wanted to give a quick COVID-19 update. So as we keep looking to strengthen our system and services for people with disabilities as a whole, infrastructure grants are being offered through the American Rescue Plan Act, or ARPA. And so we're really looking forward to these requests and seeing as they start coming in. These grants are to improve, enhance, or expand Medicaid home and community-based services. These grants can help programs become fully settings compliant, and that's the home and community-based settings rule that goes into effect in spring of next year. So there's some changes that we've been working on. The opportunity to submit a proposal is open to any Utah organization interested in improving, enhancing, or strengthening the HCBS infrastructure. This includes, but is not limited to, existing home and community-based providers under any of the 9 waivers in the state of Utah, providers of Medicaid state plan services, such as home health and personal care services, or nonprofit organizations. Proposals do need to be submitted by May 31st of this year. Okay, I think we're going to turn it over now to Olyvia Burbidge. She's from the Utah Developmental Disabilities Council, and she's going to talk about advocacy and leadership programming. And I think, Olyvia, you have your own slides. Is that right?
I do, yes. Am I able to share those?
Yeah, so I will stop sharing. And are you familiar with our interface?
I am indeed.
Okay, great.
Alrighty. Just let me know if you can see that on the screen there.
We can see it.
Beautiful. Okay. Well, let's jump right into it. Oops, sorry about that. Hi, everybody. My name is Olyvia Burbidge, and as Bob said, I work for the Utah Developmental Disabilities Council. Specifically, I oversee and advise the advocacy and leadership portion of our programming. So just to give you a little bit of background, the mission of the Utah Developmental Disabilities Council is to advocate, build capacity, and encourage systems change to support people with disabilities and their families to fully and independently participate in their communities. We collaborate with legislature, public and private agencies that serve individuals with disabilities to strengthen the service system. The focus of our council activities is to promote family-directed services that increase self-determination in individuals with disabilities and their families. And our council vision is to create a world where all people have what they need to get what they want from life. And again, like I said, my job with the council is to oversee the leadership and advocacy goals that improve Utah public policy through developing self, community, and policy advocacy skills of people with intellectual and developmental disabilities and their families. So today I'm just going to run through a couple of the programs that fall under my purview on the leadership and advocacy programming. So if anybody has any questions or wants to learn more about these, please feel free to stop me at any point, and I'm happy to give you more info as well. So the first program I want to touch on is the Advocates as Leaders Speakers Network. This is a group of self-identified self-advocates focusing on providing information and experiences related to disability issues. Each presentation is given by a self-advocate who has expertise in a variety of subjects that impact the lives of people with disabilities. Some of the most common presentations we give include self-determination for everybody, advocacy in the workplace, which that one focuses on systems change and how to ask for work accommodations. It looks like Daryl has his hand raised. Did you have a question? Okay. Daryl, if you want to jump in at any time, please feel free. So advocacy in the workplace focuses on once you are employed, one, steps to finding employment and different resources available to you. And then once you are employed, how to ask for those work accommodations and make sure that the job is the best fit for you. Couple other presentations we do is advocating for community change and supported decision making, as well as a list of about 15 more. And we do develop specific presentations for different agencies and community partners that we have. We schedule our presentations through our community partner list. So we have an ongoing roster of people in the community on all reaches of the state that we connect with. This is a group of organizations in Utah that work with people. They can be groups of people that work with disabilities or companies that would benefit from being provided with more information on people with disabilities, employing them in their businesses, or just how to make what they do more accessible to people in our communities. And if you're interested in becoming a community partner, or you know an agency that would love to work with us, I have a list or a contact form that I'm going to put in the chat for you all now. You can take a look at that, fill it out, and I will be in contact with you as soon as possible, and we can get going on that. If there's no questions on the Speakers Network, I'm going to move forward. Okay. Our next program is the Advocacy Leadership Policy Success Program, otherwise known as ALPS. This is designed for people with disabilities, family members, and allies who want to support people with disabilities and their families. This is an advanced advocacy and leadership training that helps people learn more about how to speak up for larger groups, like the entire population of the state of Utah, or all students with disabilities. ALPS also teaches people how to make changes to policies that show up in our everyday lives, like who can visit your group home and when or who gets to live in the community, or who gets supported to learn at school or attend higher education programs. We recommend the ALPS program for people who have some advocacy and community experience and want to dig deeper into things like goal setting, community outreach, legislative education, and exploring their creativity in community building. We're actually just wrapping up our second group for our Advocacy Leadership Policy Success program. They are graduating at the end of this month. And then we will be taking on new folks in September, I believe, to start up our third cohort. So that's very exciting stuff. It's been going really well. It's a fun time. All right, I'm going to move forward. People First of Utah. This may or may not sound familiar to a couple people. People First is a local group of self-advocates talking about and making positive changes in their lives and communities. Currently, this group is under construction. The council has recently taken it back under our programming. For a long while, it was an independent agency that was working towards nonprofit status. Unfortunately, that didn't see its way to fruition, so the council has decided to take it back and restructure the programming just a touch. So let's see. There are People First groups all over the country. If you do a quick Google search of People First, I'm sure you'll pop up with about 30 different groups. And some of them include the entire state. Some of them are maybe just a portion of the state or a specific territory or even a town or community. So that's what we're trying to get back to here in Utah. And most all of the People First groups that exist are in some way tied to the Developmental Disabilities Council that each state and territory in the country also operate under. The most exciting thing that I have to share with you all today is our Self-Advocacy Conference. The Self-Advocacy Conference is an extension of the People First program. It brings self-advocates together who want to learn more about self-advocacy and self-determination. This year's conference theme is A Whole New World, Navigating a New Reality and Creating Healthy Relationships. This conference is free to attend. However, you must be 18 or older. You are welcome to register. Our registrations are currently closed, but we are going to reopen registration on May 16th for a few last minute signups. The conference itself is happening June 2nd and 3rd. June 2nd will be 100% virtual. We're going to hold it over Google Meet, the same platform we're using now. And then June 3rd will be held at Murray Park, which is just a few blocks from our office space. And we have a lot of fun activities. We have a lot of self-advocates that are going to be speaking with us and running a lot of the programming on that day. So if you have not registered and you are interested, I would highly encourage you to follow us on our Facebook page to keep up with when we reopen that registration in a few days. You can also send me an email and I would be more than happy to make sure that you were all ready to attend with us. And just to dig a little deeper into how the Self-Advocacy Conference connects with the People First of Utah programming, People First of Utah really is a community-based, I wouldn't even call it an organization as much as just a bunch of like-minded folks who get together tentatively once a month to talk about what's important to them in their community. And that's why it's so important that they have access to grow and be created in communities, neighborhoods, towns, libraries. You can get together and talk about what's going on locally with your legislature, Maybe you turn your People First group into a book club. We've had those in the past. They really are just a space for you to connect and form relationships with a little bit of learning sprinkled in along the way from the DD Council. So that carries into the Advocacy Conference as kind of our yearly hurrah. We'll gather as a state. So all of those folks who are participating in the People First of Utah programming would be invited to attend the Self-Advocacy Conference. And it's just a bigger place to connect with your community, our community today being the state of Utah. And that covers my programming. So I'm just going to leave my contact information up here on the screen for everybody. You can see we have our council website at the top there, my email address, uddc@utah.gov will get you connected with our entire staff. You can reach any of us through that email. And our office phone is there as well. Again, we love interacting with the community and would love to take any questions or assist you in finding other programming that you're looking for.
Thank you, Olyvia, and kudos to all the good work you guys are doing, you and the council. This is really great.
Absolutely. Oh, I saw
Thank-
Julia put a link in there to ALPS. She has been our facilitator this year. So if you've worked with Julia, you know how excellent she is. And she's been running our group and we've all really enjoyed having her.
All right, great. Thank you. I think, so we're ready to move on to the Q&A. However, I think I see Heather is here now and Tyler. And so I'm just going to turn it over to you guys. And Olyvia, we can just leave this slide up for a minute. Oh, it's gone. That's totally fine.
Oh, sorry about that. Would you like me to put it back?
I think it's probably up there long enough, but I was just going to, if people were trying to write that information down, so maybe we can put it into the chat. But anyway, so we will turn it over to Heather and Tyler to talk. And I think, Heather, I say Ombudsman project. I'm not really sure if project is the right terminology or not for that, but I'll turn it over to you now. Thank you.
Hi, I'm really Heather Barnum, and I'm in the Executive Director's Office, and I'm really looking forward to Tyler sharing a little bit of context about the Ombuds program that was approved, is actually legislatively driven through some studies that were done by the DSPD team a couple of years ago, and then the law passed last year this last session that gave us the funding to start an Ombuds program for disability services, so or disability rights in our communities and our workplaces. So I'm looking forward to championing that hire. We do have that position just was recruited for and closed. And I've just been looking at the applicants today, and there's some tremendous experience that has been lifted that is interested in having this position and starting this program at DHS. We have decided that that individual will be at the department level. Initially, they'll be in DSPD to learn the system a little bit, and then they will move to the department in a new division called the Division of Customer Experience. And what that will do is that will give that individual the opportunity to work with other Ombuds programs, including the long-term care program, the child welfare program, and then develop the disability Ombuds program that was legislatively determined, both by the research and by our state legislature. We hope that this individual will not only start the program and build it, but they'll also look to expand it, because we know that the demand far exceeds one person. And we're looking forward to having all of you help to advocate and amplify that need in our community so that we can make that case to our legislature to continue to build this important service. The reason it will be at the department level is that it's not about DSPD and advocating for DSPD and comprehensive services as much as it is about disability and accessibility access in our communities. So we wanted to make sure that it has a total lens of what individuals in our community need. So Tyler, did you have anything to add on that? We hope to have someone on board in a couple of weeks to a month, but certainly they'll be in place by our July 1st start date as a Department of Health and Human Services.
Yeah, I can just kind of give people a quick summary of some of the efforts that we've led so far and how we got to this place and kind of what to expect with that Disability Ombuds program. So my name's Tyler Black. I'm an administrator with the Division of Services for People with Disabilities. And this has been a project that our agency has been working on for a few years. We actually received some intent language during the 2020 general session through House Bill 378, which was sponsored by Representative Daley Provo and Senator Weiler. And that intent language instructed our division to conduct a study to identify the barriers that people with disabilities experience, and also to do some research on ombuds agencies that exist in other states, specifically for people with disabilities. And we were also asked to develop a proposal for what an ombuds agency could look like in the state of Utah. So we went through the study process over the course of about a year. We did some surveying, we did some interviews with other states, and we presented to the House Health and Human Services Interim Committee in October of 2021, and basically went over the results of that study, which included some identification of barriers that people with disabilities experience. The top three being knowing who to contact with a problem, navigating public infrastructure, and communicating a problem to an entity. So those three major barriers that people with disabilities experience are all things that an ombuds office could help with. And quick summary of what you can expect from an ombuds agency is they are there to investigate complaints. So the process will be that you can submit a complaint to an impartial, independent agency. That ombuds agency will conduct an investigation through an informal, credible review process. And at the conclusion of that investigation, they'll publish a report and keep the complainant's identity confidential. The Ombuds agency will adhere to the standards of the United States Ombudsman Association. And so we are really excited that during the 2022 general session that just concluded, House Bill 150, which was sponsored by Representative Daley Provo, created this entity and provided the funding so that that agency could be created. So I'm sure we'll be reporting progress along the way at these quarterly meetings, but we just wanted to make sure everybody was aware that this new agency is coming to the state of Utah, and we were excited to be partnering with the Division of Customer Experience as they create this new position. So thank you.
Thanks you guys so much. All right, let me get this back here. Okay, I think we're ready to move on. We've got at least one question that we can answer. So I'm not sure if Jamie Douglas was going to answer this. I'm happy to, but Jamie, jump in if you wanted to. But the question is how many people are going to be taken off of the wait list for this fiscal year, and when will they be notified? So the answer to that is that 400 people will be brought off the waiting list, and they'll be brought off in these small groups over the course of the year, basically monthly. The first people will begin services in the first group has been assigned to a transition worker, and they have started to reach out to individuals and families. DSPD will notify individuals at the beginning of each month. Okay, the second question I'm going to pass off to Bryn, our employment first, but I'll read the question. So when submitting an RFS, if the individual is not interested in work yet, what should be selected under person has been informed of alternatives to day services?
Yeah, I think, and there might be others who want to jump in here, but the answer is just if you have any questions about a request for additional funding or an RFS, please contact your support coordinator. They'll help you work through that.
Okay. So I don't see any other questions. We do see a hand has been raised. Angela, do you want to unmute yourself and we'll see
Hi.
if we can answer your question?
Hi, thank you. So I'm one of the parents who has been blessed to participate in caregiver compensation. Recently, I was approved for 30 hours instead of 40. My question is, I don't have any other services or any other like caregivers. And so there's definitely more than 40 hours of care needed. 40 hours fits into my child's budget. So with the RFS saying 30 hours and it fits into my budget for 40, can I do 40 or do I have to have the RFS approve the 40?
Bob, do you want me to take that one?
Yeah, I was just to say, thanks, Kristen, for popping up there, because I think that sounds like a question for you.
So Angela, I would really want to like actually pull up your budget and look at it specifically because I don't want to give you the wrong information. So I would just suggest if you give me an email, I can pull up your budget and the RFS decision and let you know specifically for your issue.
Okay,
What it is.
thank you. What is your email?
Sure, it's Kristen Cornia, so Kristen Cornia, CORNIA at utah.gov, and I'll put that in the chat too.
Thank you.
Yeah.
Just kind of pausing for a second because I don't see any other questions, which is fine, but I don't want to not have someone have an opportunity. So I'm going to go ahead and jump ahead then to the last couple of things, some announcements. Please type in a question into the chat and we'll try to answer it right now. If not, if you submit something, we will get the answer out to you. Okay, so the last thing that we wanted to just go over were a few additional meetings that are coming up in the next little while. So the first thing is that our next meeting for the Self-Advocate and Family Gathering is August 10th. Wanted to let you know, second here. Anyway, sorry, just to let you know that there are, you can find information about our past and upcoming meetings on our DSPD website under the Individuals and Families tab, and then under the Be Informed and Be Involved heading. I think that we're going to push this meeting to 12 o'clock instead of 11:30 for the first one in August, so just keep an eye out for that. Or to noon rather than 11:30. Okay. Also coming up is for our Disability Advisory Council. Our next meeting is May 24th from 2 to 4 p.m. The public is always welcome to these meetings. And again, you can find more information on our webpage under the Disabilities Advisory Council link. The Utah branch of the National Institute of Mental Illness is holding a seminar on May 26th to inform and support people who have loved ones with a mental health condition. NAMI Family and Friends is a 90-minute seminar that informs and supports people who have loved ones with a mental health condition. Participants learn about diagnoses, treatment, recovery, communication strategies, crisis preparation, and NAMI resources. Seminar leaders have personal experience with mental health conditions in their families. Registration is required and can be found on this link, and we will stick this link into the chat. It's a registration for NAMI family and friends link. So rather than reading it to you, I'll just stick it in the chat. And I think our final announcement is the Madison House Autism Foundation is conducting a statewide needs assessment survey to learn about the autism friendliness of communities in Utah. They are seeking responses from adults with autism, family members of adults with autism, and community leaders and decision makers. And we'll post the link to the survey in the chat if you want to participate or send it to someone that you know. Okay, that is it for those announcements. I'm not sure if I saw some additional questions coming up. Don't see any in our notes here.
There was a few, Bob. I got myself off mute that time. There's one question. So if my kid is on the waiting list, all I can do is reach out to the advocacy agents to help. I would be happy to answer specific questions. If you want to reach out to me, I can take a look and answer some questions and make updates. If that would be helpful, I could put my information in the chat for you. I don't know if we have any others.
I do see a hand raised. Drew?
Yes, it's actually Dina. I've got a question.
Oh, okay.
So I'm still in my pajamas, so I'm not going to put my video on. So question for, so we are getting taken off of the waiting list, my daughter. And they have to do, I guess, a special evaluation for her because she's can't do anything on her own. She can't see, she can't walk, talk, anything. And so they have to order that and get approval for that special psycho evaluation for her to even, to start that process. How long does that take for them to get approval for that and to set up something? Typically.
That depends. So we have a certain number of contracted providers, and we've broken down, we do about 50 referrals per month. So we started in April. It doesn't take too long to get those reports back, but it can take, 4 to 6 weeks, depending on the schedule of the contracted provider reaching out.
And 4 to 6 weeks after the evaluation is ordered or done, or 4 to 6 weeks to even get approval for it?
We have already approved it. So it basically, what we do, we have our own contracted providers, and we actually fund these new reports for eligibility. So we send over the request to our contracted providers directly, and they reach out to individuals and families to schedule those appointments.
And that is within 4 to 6 weeks, you said, to call to schedule them or to have the whole process completed?
It just depends on how many
They have.
reports the contractor has. But typically it takes about 4 to 6 weeks for them. Well, I would say a couple of weeks to reach out and schedule, and then maybe about 4 weeks to complete the report.
Okay.
But that does vary. You can reach out to your waiting list caseworker and ask questions about it too if needed.
Okay. Okay. Thank you.
Okay, I think Mark has a hand up also.
Yeah, so I was kind of curious. I've gotten a couple of emails about various efforts being made, and I just kind of like an update on any of this that's being made to, I guess, lobby for the continuation and permanence of caregiver compensation, and I'd love to help out on that. Anybody know anything about what efforts are being done?
I'm wondering if Angie is online with us now. I think, Mark, we may have to try to get that, and we could add it into the notes when we post this.
Bob, Katie just listed in the chat some great advocacy groups that you can work with if you're interested in lobbying for caregiver compensation.
Great. Thanks, Kristen. It's hard to keep my eyes on everything. I saw another hand come up, but I think it's come down now.
There is one more question in the chat too about the best contact for checking on the status of a person on the wait list.
So yeah, that is dspdinfo@utah.gov. So we can put that back in the chat again. I think it may already be in there. Sure, we've got another hand raised up. Go ahead.
So I know I received an email of someone you can send a letter to about how much of a difference, the caregiver compensation has made for your family. They also attach a letter about, the points that they're trying to address on the importance of it to continue on with it. The person that you're supposed to send them to someone this week, her name's Lisa Thornton Law. She sent me an email. I'm not quite sure where the chat link is on this iPad. I'm probably just digitally illiterate. I can't find a little chat portion where I can type in that email that people can send.
So it's on the far right at the bottom, and it's the second one in, if that makes sense. It looks like a little bit of a kind of like a speaking bubble. It's right next to the triangle and the square and the circle, if it's the same screen as mine.
Yeah, I guess I'm not seeing it. Sorry, I'm really bad at this.
That's good.
So I will put that. Oh, go ahead.
I was just going to say, if you want to read it, we can try to type it in for you, or whatever works. So
she also attached a letter. Like the letter, basically, it's talking points to caregiver compensation. The title of it is DPSD Parent Caregiver Compensation Governor's One-Time Funding Request. Anyway, they just kind of have percentages on how much it has helped caregivers. Like in 2020, 10.3% of parents over the age of 18. Let's see, sorry, that's probably a waste of your time, but let me just give you the email, and then you can just kind of tell them how much it's changed your family's life to have it, and personal stories. So her name is Lisa B. Thornton, Thornton, and her email address is capital Lisa, Lisa, at lowercase Lisa, Lisa. All the rest of this is lowercase. So capital L for Lisa, Lisa at Lisa Thorn, Lisathorn, Thornton, sorry, Thornton, law.com.
So Lisa at lisathorntonlaw.com.
Yeah, Lisa Thornton. Yep. And then you can send her those letters, but I heard they need to be in by this week. So.
Great. I've got that written down correctly here.
Sorry about that I couldn't type it in.
Oh, you know what? Somebody beat me to it, and I already got it in there.
Oh, good. Yay. Okay, thank you.
Probably faster than me. All right. Have I missed any questions? Are there any hands up? Well, if there are no further questions, we would like to thank you all for joining us today. Remember the meeting's coming up, and we will see you all again in August, I hope.